So I'm going to talk you through the process of a consultation here with us. So you'll come in to the clinic and you'll be greeted by reception. You'll be filling in a form as a new patient, just so we can get details and important information from you. Then your therapist, whoever you're seeing today, will be given your details and a new patient form. You'll then be taken into one of the rooms, much like this one, and you will be asked a case history, right? So this is where the therapist is able to go into depth and really explore what you're coming in for, and you're able to discuss any sort of issues that you may be having, pain, discomfort, what have you. The next thing after that is an examination. So this is a really important part of the consultation where the therapist is able to examine your body thoroughly with regard to what was said in the case history. So hypothetically, let's say you come in with low back pain, which is a very common thing we treat here. The therapist will then go ahead and examine accordingly. So they may look at your hips, your pelvis, your low back, your upper back, as everything is quite connected, and so they will be examining that. Alright, so part of this examination process as well is special tests, or orthopedic tests as they're also known as. These are tests that test more specific conditions or things that may be going on, and certain results from these tests could lead us to refer you to imaging, like ultrasound or X-ray or MRIs, or refer to another practitioner like a GP or a doctor if that is what is needed. So it's a really important safety aspect there. After which we would then move on to the treatment phase. So here we have osteopaths and physiotherapists. So basically we are all slightly different in the way we will treat, which is great. We all have different strengths, and so we utilize those. So depending on the patient and the circumstance, the therapist will choose the best techniques and the best approach to helping you with your discomfort, pain, and for you to achieve your goals basically. So these techniques could be soft tissue work, myofascial release, articulations, joint manipulations, but then we also have machines here in the clinic to also facilitate with the treatment as well. So therapeutic ultrasound, shockwave therapy, electrotherapy, and a few other things. We've got a gym set up as well in one of the rooms, and we have quite a few pieces of equipment as well, so we can definitely help you out in terms of whatever your needs are. After which the practitioner will then talk to you about what the diagnosis is and what the prognosis is and what your journey to health will look like basically. And so they will explain the management plan and then go from there basically. And so we are here to really be with you along the way in terms of your journey to getting better, and it's a really tailor-made process. So even if you had 10 people coming in with low back pain, everyone will be treated differently according to their different body shapes, morphologies, their lifestyle, their work, etc. All right, so we look forward to seeing you the next time you feel any pain, discomfort, or you just want to come in and have a full checkup to see what may be going on.